So, hello everyone. I'm Arlene Brun from Tarlac State University, College of Nursing, BSN 1B. So, for today, we will assessing the male genitals and inguinal area. So, for the purpose, to assess any abnormalities of the genitourinary system. And then second is to diagnose disorders and diseases of the entire urinary tract and the genital tract. And then third, to plan for appropriate interventions pertaining to genitourinary problems. And then lastly, to evaluate for improvement and response to the management. And then after that, for the assessment, determine the client history of the following. So, usual voiding patterns and any changes bladder control, the urinary incontinence, the frequency or urgency of the patient. So, sir, nakakaramdam po ba kayo ng mga ganito like incontinence, yung hindi nyo po napipigilan yung pag-ihi po ninyo, ganyan po? Okay po. Yung ano naman po sir, yung any discharge po. Kapag halimbawa po is check nyo po yung private part po ninyo. May napapansin po ba kayo? Okay po. And then the abdominal pain. So sir, nararamdaman niyo po ba na sumasakit po yung abdominal pain po ninyo? Okay po. And then after that is any symptoms of sexually transmitted disease. So, sir, nagkaroon po ba kayo ng any kinds of symptoms sa pamamagitan ng sexually transmitted disease po? Okay po. And then after that is the any swellings that could indicate presence of the hernia, the family history of nephritis, the malignancy of the prostate, and imaginary of the kidney. So sir, nagkaroon po ba ng any kinds of presence of hernia sa inyo po? Or family history po sir? Nagkaroon po ba yung mga ninyo po ng mga malignancy of the prostate or imaginary malignancy po sa kidney nyo po? Okay po sir. And then after that is we will proceed to the planning. So first is plan for the step needed in assessing the patient genitals and the inguinal area. So first is assemble equipment and supplies. We have examination gloves, the drape and the supplement lighting as if it is needed. And then for the implementation, we have first is to secure the environment or the procedure. And then after that is explain to your client what you're going to do and why it is necessary and how the client can cooperate to you. And then after that is wash the hand and observe the appropriate infectious control procedure. So we have here the alcohol to remove all the microorganisms. And then after that, perform a proper gloving. So we have here a pair of non-sterile gloves. So when you when you're wearing your gloves, make sure do not touch the cuff of the um, gloves, and make sure there will be no contamination. So I use the glove to glove technique. And make sure there is no excess when you're wearing your non-sterile gloves. And then after that is to provide for the client privacy, close the doors, the windows, and the curtains. And then after that is to position the client in the supine position, and then alternately assist the client into the dorsal recumbent position with knees flexed and thigh externally rotated. And then after that, inspect the pubic hair of the amount of hair, the characteristic of the distribution of the hair of the pubic of our patient. And then after that is inspect the skin of the pubic area of the if there's any parasites, inflammation, swellings, and any kinds of lesions. So, inspect lang po natin kung meron pong any kinds of inflammation, swellings, and the so, okay naman po siya. And then after that is the shaft and gland of the penis. Inspect the penis, shaft, and glands penis for the lesions, nodules, swellings, and inflammation. So, we will inspect the penis if there's any nodules, if there is any lesions. And then after that is the inspect the urethral meatus for swelling, inflammation, and discharge. So check if there is any lesions, discharge, and inflammation in the meatus of the penis of our patient. And then after that is compare the compress or ask the client to compress the glands slightly to open the urethral meatus to inspect if there's any discharge. So, sir, can you slightly open your urethral meatus po? Check lang po natin if there's any discharge po, sir. So, check lang po natin if there's any discharge. And then after that is if the client has reported discharge, instruct the client to strip the penis from the base to the urethra. So sir, if there's any discharge po, hawakan nyo lang po dito sa may from the base to urethra. And then after that is palpate the penis for the tenderness, the strengthening, and the if there's any nodules. And then use your thumb and first two fingers to palpate it properly. So palpate if there's any tenderness. And then palpate if there's any nodules. And then after that is we will proceed to the scrotum of the patient. So first is to facilitate inspection of the scrotum during the physical examination, and ask the client to hold the penis out of the way. So sir, can you hold your penis? We will make a physical examination to your penis po. And then after that, inspect for the appearance and the general size and symmetry. So we will check the scrotum if they are symmetry and the size of it is equal. And then after that is inspect all the skin surfaces by spreading the spreading to the surfaces and skin, and lifting the scrotum as needed to observe the posterior surfaces. So we will inspect the skin of the surface by spreading the surface. And then palpate the inspect also the skin surfaces into the posterior surfaces to observe the posterior part of the scrotum. And then after that is to palpate the scrotum to assess the status of underlying the testes, epididymis, and spermatic cord, and palpate both testes simultaneously for comparative purposes. So we will palpate the scrotum. And then after that is the inguinal area of the male. So So, let's assume that this is the inguinal area of the male. So, inspect the both inguinal area for the bulges while the client is standing if it is possible. So, sir, pwede po ba kayong tumayo para po makita po natin or ma-assess po natin maayos or ma-inspect po natin ng maayos yung inguinal area nyo po. So, yan po. Inspect lang po natin. So, let's assume that this is the inguinal area of the male. And then after that is first have the client remain at rest. And next have the client hold his breath and strain or bear down as through having a bowel movement. We've done with that. And then palpate the inguinal area and assess for the presence of the lymph nodes, hernia, or the inflammation. So we will palpate the inguinal area. If there's any lymph nodes, if there's any hernia or the any kinds of inflammation. And then after that is to document all the findings of the client record, and for the evaluation, perform a proper hand washing after the procedure, and you can reassess the patient for any kinds of discomfort or the problem after performing a assessment of the genital and the inguinal area of your patient. So before anything else, don't forget to remove the non-sterile gloves. Be careful. And perform a alcohol. And then after that is record the client findings. So, thank you po, sir. So, this is the end of the assessing of the male genitals and the inguinal area.